Today is a very, it's a day that all of us are going to be proud of. It's one of those days that sometimes we take out so that we can be able to help those ones in our society who need our services but don't get it. And where a lot of frontiers will be able to give their time and energy, their services and their skills so that they can be able to assist these patients who will be coming in for repair of their congenital cleft lips and cleft palate. These are deformities that, as you know, bring a lot of issues to the family and the children themselves when they are born, because they don't look normal. They look very deformed, and they sometimes find it's very, very difficult. I think one of the things that we must be able to realize that, look, I think even from time immemorial, even during the time of Christ, if you remember in the Bible, it says that, look, when they were asking Jesus that, when did we do these things for you? And then he said that, I tell you, if you do some of these things to the least of this in our society, then you have done it for me. And sometimes what we don't realize is that, how many times do we really care about the needs and problems of people who are around us? Most of the times we focus on our problems ourselves, individual problems, which sometimes day in, day out, but they don't help you. But imagine that you help these people who have come, who have nobody else. In fact, you will be finding that some of these patients have not been able to be seen for as many people as possible as they will be seen in this period of time. It's a special time because the Nairobi hospital has graciously agreed to sponsor these kids, 16 of them, to have what we call reconstructive surgery to repair their lips and cleft palates. And if you know that that's one of the top-notch hospitals in this country, that at least they can be able to sacrifice and offer services to these children who are coming from very poor families. In their life, in their dreams, they will never be able to dream that they can have these services in the Nairobi hospital. Not alone that, there are many people who have come forward to frontier and give these services. Not necessarily giving money, but even giving their time and effort to ensure that they give their knowledge, they give the support, they talk to these children, and also help us market this program so that people can be able to help us take more care of these children. Because for every one child that we treat, there are about 10 or 15 of them who are waiting outside there. And the moment they see us doing this work, they also wonder that why us? Why are you not taking care of us? We could be able to take care of this and make sure that no child is born with a cleft lip and is not fixed immediately, so they don't have to do it. I've just seen a small kid down there who is 1.5 months with a bilateral cleft palate. But you can see the mothers, they are there. They want their child to be seen. They don't see the deformity themselves, while us would be able to sympathize. So it's a special time, it's a special occasion that we can all be able to come forward. Look at the people who are even doing the free advertising, free taking the photos and making sure that we document all these things. Because we have found in the past, we don't document what we do. When we talk about universal healthcare, this is one way that we can be able to be part and parcel of that universal healthcare. So we are able to give these people need as required. Our appeal is that, look, as Kenyans, first of all, as organizations, as groups, can we be able to come forward and support these kind of initiatives? So that we not, instead of doing 16 patients in a weekend, we can be doing close to about 500, 600 patients in a year, for example, helping them in one way or the other. This is indeed very special. And we're looking forward to a very fruitful time. Thank you so much.